A very good afternoon, everyone, and welcome to the session on the topic Introduction to Menopause Health Issues of Menopausal Women. Today, we welcome our Dr. Nithya Babu Kumar from Apollo Cradles and Children's Hospital, Chennai. We welcome you, ma'am. So, everyone, if you have any doubts, any queries related to the topic or around the topic, you can ask our doctor in the session. Also, it's going to be a very important session. Uh, all the details, women's of this age who are facing menopause or having issues like that, should watch it and stay tuned till the very last so you don't miss out on important details. And just post all your questions on the comment section. We'll take it in the last while we conclude. Over to you, ma'am.
Thank you so much. Uh, Good afternoon, one and all. I am Dr. Nithya Babukumar, consultant here in Ox and Gynae. Today, this topic is exclusively for middle-aged and those in perimenopause who are already menopause and post-menopausal women. Why I chose this topic is like of late I see many middle-aged women say in their late 30s, 35, come with back pain, knee joint pain, so much of stress they have. So I thought it would be a clearer view. Are they have a lot of misconception that am I going to have menopause at early stage? Or all these menopausal symptoms, whenever they have so much of stress, whenever they feel that lot of depression, whenever their cycles are swinging, they feel that they are in the perimenopausal and they will be going to the menopause in a few years. So I just wanted to clear out the doubts for these people, especially the middle aged and 40s, late 40s. So what is menopause is like absence of menstrual cycle. That the perfect definition is absence of menstrual cycle for 12 consecutive months. For the entire stretch of 12 months, not even single spotting will be there. So, or else if there is a spotting in between, or if there's a cycle, say after 3 months or 6 months, also we not call as menopause. So, still she is bleeding. Uh, a perfect definition is for the entire period of 12 months, there'll be not even a spotting. So that is called as menopause. And what happens? So that is all. That is only absence of periods is not only the symptom. Along with that, mainly hormonal. Say the absence of sex hormones, estrogen and progesterone, also the testosterone. When there is these hormones slowly deteriorate, when these hormones slowly goes away, then we say she has attained menopause. What is the term perimenopause? What is this perimenopause? Is this fluctuation of the menstrual cycle is perimenopause. Say 3 months once, 6 months once, if the women in the reproductive age group, say for 35 to 40, 45, she is having this fluctuation of frequency cycle, then we can tell it to be perimenopause. Need not, provided her age and whether she doesn't have any other symptoms of polycystic ovaries or hyperthyroid, everything should be ruled out. So, what is the ideal age then? Ideal age of menopause is like 47 to 52. By this time, the women will attain a menopause. More than 55, 56, and all very late for her. So ideally 47 to 52 is the age nowadays the average Indian woman attains a menopause. So just prior to this is the perimenopause, when there's a fluctuation of this menstrual cycle and subsequently the fluctuation of these female sex hormones. As I speaking of age, some women say when they attain menopause like 35 to 36 years, less than 35 years, then we call to be premature menopause. Why? What is the reason for this premature menopause? Can be first thing, their uterus, their ovaries may be weak, or sometimes genetic issues. Their relatives, their mom, a cousin, maternal aunt, anyone. The same. When there's the early menopause, when they have premature menopause, it can be genetic also. Or some women who's having any autoimmune illness or smoking, any drug abuse, taking medications, chemotherapy for any other illness, say any cancer, breast or something. When they're taking chemotherapies or take any other medications, they also can have early menopause, like 35, 36. Apart from that, lifestyle changes, lifestyle, their food habits, etc., also involves the role. So these are the reasons for premature menopause, so less than 30 to 36 years. So what are some symptoms of menopause we have to see? So when a woman going into menopause or perimenopause in that age group, what are the symptoms she can face? First, most common symptom, what they say is like sweating. Night sweats and hot flushes are the most common symptom they present. They'll be ambient temperature, AC room or whatever it is. When others don't sweat, she may sweat. She may sweat, a jacket may be wet. So this is the first symptom she feels. And especially, this is so annoying, significantly disturbing her night sleep. When it disturbs her night sleep, then she has it as a main complaint. She tells the doctor, I cannot even sleep. Sleeplessness night is mainly due to this hot flushes and night sweats. So apart from that, lack of energy. She feels very tired. Routinely, she's not unable to carry her day-to-day activities. Often she feels so tired. By the end of the day, she feels worn out. Lack of energy, rather say. Due to decrease in the sex hormones, also there will be lack of libido. So she's a sexual act, a life may be sexual life may be little disturbed for her. In that way, also people complain that I could not perform well. Is there any reason? Why? What can be done, doctor? So these are the symptoms of perimenopause, especially entering into menopause. And next most common symptoms is like joint ache, muscle ache. They have knee joint pain, they have back pain, their neck pain. Most of them complain. These are the common symptoms they complain: joints and muscle aches. And one more complaint I want to say is like memory loss. When they are in the late 47, 48, no, they stop forgetting things. So memory loss is also like very short term, we can say. Memory loss, declining the mental age ability. This is also one of the symptoms of menopause. The most Another most common complaint of late I get is this urogynecological problem. That is the poor bladder control and recurrent urinary tract infection, cystitis. Either the scan report shows cystitis or recurrent urinary infection also is a common complaints of this menopausal age group. So I'll tell each one how to handle one on one and when to see the doctor. Apart from that, how they have to take care personally. Coming to the stress and menopause, this because of this midline transition, the time of menopause can be very stressful with different people. Uh, uh, they have wide range of stress. Say from physical, they become emotionally unstable. They get angry too much, or they shout out too much. Their children, their spouse, etc. So because of the demanding, these growing children are so demanding, they have to take care of the elderly parents also. So it's like a sandwich between the generations. So they get too much of stress, the social work as well as homework, home activities. So regarding the stress is so common. So I will recommend for them to meet a psychiatrist as well as a gynecologist and take care of themselves. They have to go for a counseling to avoid this stress because they can't take it for a longer time. When they are 50s or 60s, then it will be worsening for them. Mainly, these are the hormones. These are the reasons being the hormones. Second thing is like for the hearts, hot flushes and night sweat. Of course, they have to meet their gynec. Some people they can have this hormone replacement, HRT, hormone replacement therapies, but not for a longer time. This HRT, in fact, improves their hormone levels, and that way this hot flushes and night sweats won't be there. For this joint pains also it improves. So mainly this hormones, sex hormones, estrogen and progesterone. As age advances, the progesterone becomes very low. That way estrogen also starts falling. Uh, so these because of these hormones, they start getting joint pain. So they can be on HRT only if your doctor prescribes. Or else, if you are not eligible candidate for this hormone replacement therapy, then you should not go for it. Speaking of that, we have to also know about the health issues other than that, what to face. First thing is like they have to have a regular health checkups. So when they are entering into this age group of 40, late 40s, I said, they have to have a health check done, which includes the complete hemoglobin, their lipid profile, their pap smears, their ultrasonography, as well as a mammogram breasts. Mainly, why we focus on these things issues like once they enter the age of 40s, this hormone level starts declining, and they may get other associated illness also. For example, first thing is like why pap smear is important. Pap smear is a cervical cancer screening which every women have to go undergo once in 3 years to 5 years, especially after menopause. After 50, every 5 years once she has to go for menopause. This is mainly to prevent cervical cancers. Second thing is breast mammogram. Why essential is because of the breast cancers. So every women reproductive age group they have to do breast self examination to know whether any mass or any swelling. Even menopausal women they have to take a mammogram at least once or twice, two yearly once, and they also have to do a breast self examination to prevent from breast cancers. Other lipid profile, cholesterols, and they have to take care of their heart. Speaking of that, the estrogen is essential hormone which insulates your heart. So, post menopause, they can prone for more heart cardiac pain and cardiac events. So they have to take care of their heart. And this muscles and joint aches, they have to have a lot of exercises. So exercise is also essential for menopausal women. Exercises, more of anaerobic exercises. That is, they can either go for a walking, they can do like per week, 3 days a week. They have to schedule their exercises so that they feel healthy. So like we have discussed about the investigation, what to do. Now we'll come to diet. Especially menopausal, a healthy gut is necessary for this healthy hormone production and metabolism because most of the menopausal women can have what is it constipation. Their constipation as age advances. So to prevent this, you have to have a lot of fiber diet, more of seeds, salads, fruits, and diet, and regular exercise. That is 30 minutes of exercise, at least 3 days per week. And they have to have a good social uh, friend circle to prevent the stress and more of meditation, yoga. They have to take care of themselves. Then supplements. Supplements is also very, very essential for these menopausal women. Uh, Supplements, like apart from the diet, with the calcium supplements, vitamin D should be taken, included in your the daily diet. Regarding daily diet, have lot of calcium. Ragi is a good source of calcium. Curd, milk products have milk twice a day. Milk also is rich in calcium and more of fiber diet. Fruits and vegetables should be included in the diet. Meet your doctor, get your health check done, take care of your diet as well as supplements. Regarding urinary tract infection, menopausal as well as perimenopause as well as postmenopause, the private part is very dry, so they are prone for urinary tract infection often. This UTI and cystitis. Apart from that, they have urinary leakage problem. Why? Because as a fall in estrogen, the private part becomes more dry, and there's a lot of the incontinence. They are prone for incontinence also. One of the reasons. So I will recommend them to have a urogynecological consultation to do urine culture to investigate why there's a like, infection. Second thing is like to do Kegel exercises, the pelvic floor muscle strengthening exercise. With your doctor, under your doctor recommendation, you can go in for any local creams, the estrogen creams to prevent dryness and itching. So these are the tips to prevent urinary tract infection and pelvic floor exercise to prevent future prolapse as well as incontinence. That's what we say Kegel exercise to prevent incontinence in menopausal women. Apart from that, cancers, I told about pap smear, right? Because postmenopausal women, they are more prone, if at all they have, what are the symptoms I'll tell. For example, postmenopausal women, for the entire 1 year, she doesn't have uh, periods at all, then she's considered as postmenopause. Even after 2 years or 5 years, off late, or suddenly if she's having bleeding, say after 5 years, then she has to go to the doctor. This bleeding can be any reason, but she has to take ultrasound and she has to rule out with the endometrial biopsy of the pill, because endometrial cancers is also a risk. It is 2 out of 10,000 people can have endometrial cancer also. So she has to be investigated and treated. And regarding breast cancer also, there are risks for breast cancers even in postmenopausal. Family history of breast cancer, say, as I spoke before, maternal cousin and mom, someone aunt is having a breast cancer, then she has to investigate. She has to take care of your breast health also. Mostly, cardiovascular risk is also a big. Risk is also more in case of menopausal women. So she has to take care of her heart health. As I said, she can have a good diet, good exercises. She can have a good fat. For that. So I have to take care of the cardiac health also. Mm, um, with that, I think you can ask any doubts you have. Hello. Thank you so much.